Can everyone see my PowerPoint presentation?
Yep.
Okay, great. Well, welcome to the February Mobility and Access Coalition for Boulder County. I'm going to go ahead and give a brief overview. We don't have a super full agenda today, so that'll be good to be able to share some best practices. So just in general, reminder that with Zoom, the invite that you, after you registered, should have the one-tap call. So if you lose connection during the presentations or during the meeting at all, you can just click on that and you should be able to access through your phone. You won't be able to see the presentations, but you should be able to listen in. And again, just a couple of housekeeping rules or housekeeping features here. So mute is in the bottom left-hand corner. Please make sure that you mute yourself if you're not speaking so we don't get any background noise. And also video helps with communication in the virtual space. You can click on participants to see who else is on the call, and then you can click chat to ask any questions. And we have Jessica and Cami on the call, so we'll have somebody paying attention to those chats, and just if I don't see it, just call it out. And then I think that's pretty much it. We are recording, just so you all know. This helps us with taking minutes and being able to be fully present while the meeting's going on. So just in general, we meet the second Monday of the month, and we focus on networking to do information sharing around transportation, capacity building, making sure that nonprofits and human services organizations are plugged into the transportation conversations. We work on our work plan. So from our Mobility and Access Coalition, our Mobility and Access for All Ages and Abilities plan, we have some items that we'll be focusing on this year. We have presentations from external partners on planning efforts that are going on, and then we'll do project updates as well. And just a reminder, at the Mobility and Access Coalition, we focus on transportation as a social determinant of health. We believe that transportation is essential in achieving equity, and transportation access means access to opportunity, improved quality of life, and it allows people to meet their basic needs. We really try to ensure that people can achieve safe or thriving through transportation options. So we know that one mode of transportation doesn't meet everybody's needs, and at different times you may need different modes of transportation. Here is an overview of our agenda for today. So we're gonna have a breakout session, we'll do some organizational updates, and then we have a presentation on the RTD Northwest Rail Transit Equity and Environmental Justice Update. We also have a presentation from the Division of Vocational Rehab. And then we're gonna, hopefully if we have time, we'll get into some of that planning around the types of members that we want on we wanna make sure that we recruit and retain on the MAC. So an example of icebreaker, we're gonna break out into some small groups. And I'm not sure, Jessica, how many groups we have here, but in general, when you get to the breakout, make sure you give your name, your organization, and then we're just going to talk about a couple of examples of how you've helped somebody you serve access transportation options. So whatever that is, we'll have a discussion when you all come back, and we'll do a report out. So just make sure that there's somebody from your group kind of tracking like what examples you all gave. And this is a way for us to understand the complexities of how you're serving people with transportation needs. So unless we have any other questions, Jessica, I think we're ready to break out into breakout rooms.
Yes, I have 4 different breakout rooms. All of them have 5 people except for room number 4. So room number 1 is Annette, Elaine, Martha, Patrick, Rebecca. Room 2, Bobby, Corey, Megan, Michael, and Penn. Room 3, Betty, Cami, Lindsay, Megan, Stephanie. And room 4, Angela, Danny McLean, Lauren, and Sarah Lee. So we'll be back in 10 minutes. Just remember, talk about a moment or a time when your organization helped somebody in a transportation need. Okay, see you in 10 minutes.
I'm gonna pause it real quick.
Yes. Right, yeah, I think everybody's back.
Great. So just in general, why don't we do a report out for like what you all were talking about, if there's any good examples that you want to share with the team. The first group is room 1 with Annette, Danny, Elaine, Martha, Patrick, and Rebecca. Does anybody want to speak for that group?
And I took a couple notes. It seems like a lot of us are already sort of working in this sphere. So a lot of it is just having the information and including the information early as projects are evolving seemed like, you know, one of those key components, because as was mentioned, if you wait till the end, you know, how easily is that actually incorporated? For a few folks in the group, it's like a real primary focus are the equity issues. For somebody like myself, just I actually mentioned the knowledge I've gained just by attending these meetings is really helpful, so that when people do have those questions for their business, it's really great to know and have the resources that this group is so rich in.
Wonderful, thank you. So how about the second group? So Bobby, Corey, Gabe, Megan, Michael, and Penn. Does anybody want to speak for that group?
Or should we just choose somebody?
I think Penn's talking, but she's muted.
Oh, sorry.
Yeah.
Gosh, and it was like a save the world moment, and you couldn't even hear me. Sorry.
Oh, no.
You fix all of the problems.
But like the first group, we did definitely had some professionals in this area, but we did have a diverse group, which was nice. And so some of the notes were one of our speakers today, Megan, was talking about the neighborhood transportation project, you know, and one of the things that they're doing is working on widening bike paths and making that transportation easier. Let's see, Corey talked about Ride NoCo and what they're doing up here in Northern Colorado. And then I'm not going to be able to read my notes. But then we talked about ride shares, which was awesome. That's being covered in Boulder as well as Denver. And I know that there are other communities around the state that are working on that. And then we also talked about AINC, even though we don't provide direct transportation, we started a white cane project where we provide high quality white canes to those people who need them throughout Colorado. And so that covers everything, right? From going to the mailbox to getting on a bus or a ride share or however. So yeah, it was a great group.
Well, that's wonderful. Maybe we'll have to have a formal presentation on your white cane initiative.
Yeah, I am interested in that because my cane is broken. So
oh no, yeah.
Yeah.
It's not like too broken. It's just like an annoying kind of broken.
No, canes are like being pregnant, is either broken or not broken.
That's true.
One or the other.
Yeah. Then it's broken.
It's broken. Reach out to me.
Okay.
That's great. So the next room is room 3, and I believe it was Betty, Cami, Lindsay, Megan, and Stephanie. There's a lot of E's in there. Does anybody want to speak for that group?
I don't know if anyone else in my group took notes, but I didn't take notes. But from what I remember, we all kind of are somewhat involved in the transportation field and area, and kind of each have our own individual experience with that. But one thing that I kind of thought was really interesting was Cami was sharing how she has like kind of a unique perspective of like having 2 different school districts, and there was a situation where they were trying to find transportation from like a mobile home park area. And one of the solutions was bikes, and they didn't have any available in that area. So she reached out to the other district and kind of problem solved and figured it out. But yeah, I mean, here, like at Dr. Mac, we kind of, we talk to people all the time and share out resources. So I thought that was interesting. And then we also talked about how we're all kind of noticing that there are more complex transportation scenarios coming up, rather like a couple of years, 2-3 years ago, it was kind of a little bit simpler. And I don't know if that was from the pandemic or just, things have changed, but transportation needs are evolving and changing.
Yeah, that's a good point. Thanks for sharing. Next one is room 4. So that was Angela, Danny, Frank, Lauren, Natalie, and Sarah. Anybody want to speak for that group?
I think we all also work already directly with customers and help people pretty much on a day-to-day basis based on the agencies we're working for. Sarah had a nice little story.
Oh yeah, about the buses.
Yeah.
The Access-a-Ride buses. They like all
Yeah.
have names. And then somebody said like, you should put it in our VL newsletter. You should put the stories in there, or like a coloring book or something. So that would be fun.
That's great. Okay. We'll have to have you talk about that a little bit more formally, Sarah. Maybe we'll have it on one of the future meetings. Sarah is in love with Access-a-Ride, so.
I love Access-a-Ride. They're like my favorite.
That's great. Okay, I'm gonna go ahead and share back the presentation. Thanks for getting warmed up and just chatting with everybody. Good opportunity to just get to know everybody who's on the call. We just have a couple of updates. So can you all see, oops. Okay, can you all see the Dr. Cog transportation improvements? Okay.
Yep.
So just want to let you know that there's 20 different projects that community partners like the City of Boulder or City of Longmont or Boulder County had applied for the Dr. Cog transportation improvement projects. There is an open comment period. I'll walk you through how to find or how to add comments. Comments are due by 5 p.m. on February 22nd. I will put in the chat after this the link for the press release. But this is what the press release looks like. You all probably got it in your inbox last week, but it outlines the 20 different applications that Dr. Cog received for our sub-region. There were 10 that Boulder County had applied for. This list here is for Boulder County specific projects. Down here under provide your feedback, there is a link that says Dr. Cog's web map. If you click on that, it'll bring up a GIS map here. It has like a pop-up window. It might not pop up because I've clicked on this before. Yeah, it is. So basically it's a welcome to the TIP comment map. And it says that the roadway map or the roadway improvement projects are in blue. The bike ped projects are in orange. The transit multimodal projects are in green. So you can just X out of this. On the right-hand side here are the lists of the projects. Where this gets tricky is our area submitted 20 different proposals, but this is the list for all of the area. So I'll click on this first one here. This is Boulder County Vision Zero Safe Routes to School Action Plan. This is a project that Cami had applied for. And if you click on the name, it pops up the map of the area. And then it talks about how much it costs and a little bit of a description. And then you can add a comment by clicking on blue. It has your organization, the name, if you support the project, if you're opposed to the project, or if you have concerns about the project. And then you could write out your comments and then submit. So there are, again, on this press release, there are the 10 projects that Boulder County had submitted. But there's also some projects that you want to pay attention to for the City of Boulder, City of Longmont, Louisville, Superior, and Lafayette. So does anybody have any questions on how to comment on these projects that we're proposing? So there's just a couple of highlights. There's definitely CAMI's project, the Vision Zero Safe Routes to School Action Plan. There's the strategic transit plan for the whole county. There's also a Erie Flex Ride. The town of Erie is proposing a Flex Ride service. The project that I asked you all for letters of support for was the Southeast Boulder County Superflex Demand Responsive Service. And there's others down here, but if you have any questions, don't hesitate to reach out. This is your opportunity to get your feedback on that. Okay, gonna go ahead and move on to the next topic. Just want to let you all know, and I'll put in the chat after this when Dr. Mack's giving their update, but we have an IntelliRide Lunch and Learn. So many of you serve people who depend on IntelliRide. IntelliRide is the brokerage service for Medicaid transportation in the region. So this is probably one of the top complaints that we get here at Mobility for All is issues with IntelliRide. So I've asked their community, the gentleman who oversees their community advisory committee, I've asked him if he'd give us an IntelliRide Lunch and Learn on how to access IntelliRide, how to deal with frequently asked questions. So it's definitely our opportunity to get some clarification on IntelliRide. And I know there's definitely, Megan, I think you're an IntelliRide provider as well. So you could definitely chime in from a provider standpoint. But does anybody have any questions on the IntelliRide Lunch and Learn that's coming up on the 21st of this month?
I thank you for putting it on. I'm excited to hear what they have to say.
Yeah, it'll be good. I think that Kevin Lang, he's the gentleman that I've been working with, and he is basically overseeing the community advisory committee that I'm on. So I'm hoping that we can get some clarifications on some things, but it'll be good.
Angel, will it be recorded?
It will be recorded, Anna. Okay. So I'll be sure to share it out after the fact.
Great. Thank you. I may have a conflict and I'd really like to get this information. Yeah. Okay, thank you.
And for those of you who don't know, we've been doing this Lunch and Learn series for a couple of years now, but we're going to try to make it through all the major transportation providers this year. We did Access-a-Ride last fall. We are working with VIA to also schedule one for May, I believe, for VIA. And these are all about just working or talking to nonprofits and organizations like yourself to talk about frequent barriers or just how people can access the services. So our goal is to have all of the major transportation providers in the area have a recorded session by the end of the year so that we can refer people to those. It's been really helpful for Access-a-Ride. Whenever we get questions about Access-a-Ride, we just give people the recorded Lunch and Learn link. So that's good. So at this point, I'm going to turn it over to Stephanie. Do you want me to stop sharing so you can see people's faces, or are you good?
You can leave it up. Thank you. So Dr. Mack is going to be hosting a community listening Lunch and Learn this coming Wednesday from 12 to 1. It'll be on Zoom. And essentially the reason that we're hosting this is because Dr. Mack is the regional coordinating council for 9 counties of the Denver metro area. So that includes Adams, Arapahoe, Boulder, Broomfield, Clear Creek, Denver, Douglas, Gilpin, and Jefferson counties. Each county has a local coordinating council and LCC. So this is one of the groups, the Boulder MAC, and some of the counties have super successful LCCs, and some don't even have any LCCs that are currently running. So we just wanted to create a space and open up the community to sharing ideas and suggestions and kind of get that going, because of course, the more resources we have in each county, the easier it is to connect between each area and share information and connect folks with various resources. So I'll paste the registration, the Zoom registration link in the chat with the details, but everyone is welcome. If you're not, or if you're here, you're a part of the Boulder MAC, but if you know anyone who's not currently a part of an LCC and is just interested in learning more or wants to be a part of one or just anything, everyone's welcome. And I encourage you all to come and hopefully learn something new.
Great. Thanks, Stephanie.
Yeah.
Any questions for Steph? Excuse me, for Steph before we move on?
I have a quick question. Thanks, Stephanie. Just curious about where we could find this online to share it out. The Dr. Dr. Mack, I just quick looked on their Facebook and I don't see it. Is it somewhere else?
Yeah, it's on our website. I will do that. And then I can also, I know Angel, I know you have the flyer, but if it's helpful, I can send like a PDF of the flyer as well. But it is on our website, and I can put that link in the chat as well.
Okay, thank you.
Yeah, I just Googled it, and it's like right on their front page of their website too. So.
Okay, I'll go to a website instead of Facebook.
Thanks.
Thank you.
And just to provide a little bit of context, coordinating councils, they kind of, they started rising up probably the early 2000s. There is a federal version that's called the Coordinating Council on Access and Mobility. And that's really a cross-departmental forum to improve transportation, because the federal government really acknowledged that they were funding transportation in a variety of forms, right? Through FTA's funding, through Area Agency on Aging, through Medicaid, and they realized that a lot of people weren't talking to each other. So they have strategies at the federal level to really prioritize that cross-sector discussion around transportation. And then we have different layers. So there's the Colorado Mobility and Access Council, which is a peer-to-peer agency that like Corey's on and Stephanie's on as well, but that's like trying to coordinate transportation issues at the state level. And then at the regional level, Dr. Mack is our coordinating council, and they help coordinate regional issues. And then we have local coordinating councils, which is the MAC. So it's the principle is the same throughout, in that we're trying to overcome cross-sector collaboration, or try to encourage cross-sector collaboration to improve transportation for underserved folks. So yeah, looking forward to that lunch and learn. And I will go put that in the chat here shortly. I'll add all of my comments, all my links after the presentation starts. So let's go ahead and go. Does anybody have any other MAC updates before we get to the Northwest Rail presentation?
I have one just quick announcement just to put it on people's radar if they feel inclined. It is School Bus Driver Appreciation Day next week on the 22nd. So I guess that might be a week and a half. And we have a thank you card that we can share out, or share the link if you all want to share that with people you know who might want to print out a thank you card and give it to your driver. But keep that in mind for next week. For any driver, whether they're a school bus driver or one of the local public bus drivers, doesn't matter. Anyone who helps kids get to school, they get a day for themselves. So as well deserved.
That's great. Yeah, and keeping in mind that there is a driver shortage even with the school districts. So it's really important to recognize school bus drivers and just drivers in general, because they play a vital role. Yeah, it's great. Okay, so I'm going to go ahead and turn it over to the RTD Northwest Rail group. Did you want me to share the presentation?
Sure. I think Patrick, is that, yeah, that's our preference. We have it too if we need it, but.
Okay. Let me go ahead and pull it up. If you want to go ahead and introduce yourselves right off the bat while I'm pulling it up, that'd be great.
I will. So good afternoon. Thank you for the opportunity to speak to you all today. My name is Patrick Stanley. I'm with RTD. I'm the Northwest Rail Peak Service Study Project Manager. My official title is Manager of Engineering Programs. So I got other stuff trying to get done as well at RTD, but this is a primary focus for me. I've been just real quick, I've been with the agency since 2010. An architect by training. Actually was the station's oversight manager for the Eagle project, the A, B, and G lines. And then since then I've worked on the North Metro line as well. So quite a bit of my experience is actually on commuter rail. So hopefully that carries over and means something to the study here. With me today, we've got Annette Hunter, who is our transit equity specialist for the project. With RTD. I don't know if Annette wanted to say too much, but I will. She's been a great help as we work through the process. And as well, we've got Megan Boydston, who is with our consultant. She's the deputy project manager for our consultant team, working on transit equity and environmental justice. So, Megan, I don't know if you wanted to say a few things or not.
Sure. Yeah, I'll just say, you know, I'm leading the transit equity and environmental justice task on the consultant side, as well as the transportation planning task, but really excited to be here. And thank you so much for the invitation to speak today.
And you'll hear more from Megan later on here in the presentation. So, okay, next slide. All right, so what is the Northwest Rail? And I know many of you probably already know what the basics for the Northwest Rail is and has been for a while, since 2004 in particular. But you know, it's a proposed commuter rail service that runs from Denver DUS, Denver Union Station, all the way to Longmont and through Boulder. This particular study, we're looking at you know, the 35 miles that need to be extended from the existing Westminster station that was built as part of the B line, which was opened up in 2016. So now we're looking at, you know, how can we possibly do a first step type service to get people moving on the corridor? And that's what the study is all about. So a little bit about the history of the project. As many of you know, Fast Tracks passed in 2004. That did include Northwest Rail service. At the time we did the environmental evaluation in 2010, that was a 55 trips per day, full service, full double track scenario for the Northwest Rail. In 2013, realizing, you know, we've had some funding issues that have kept us from completing the corridor to date. We did the Northwest Area Mobility Study. Northwest Rail was talked about as part of that study, along with other BRT and other routes in the Northwest area. In that particular study, we looked at the Northwest Rail really as more of a, I'd say, kind of phasing it in increments and segments. So it would be, you know, it was from Westminster Station to, you know, Broomfield, or kind of pieces there, not necessarily what we're looking at for this study, which is more of a service phasing. 2016, the B line opened up. That was part of the Eagle project. And then, of course, in 2017, the concept for the peak service concept, I would say, kind of grew a little bit organically between RTD and the Northwest area stakeholders as a concept to explore. So next slide, please. So what is the peak service? Specifics are, you know, we're looking at 3 trips from Longmont to Denver weekly or weekday in the morning down to DUS, and then 3 return trips from DUS to Longmont in the evening. You know, we're partnering with our stakeholders and partners up in the area to plan 6 new stations. Those stations are in Westminster, Broomfield, Louisville, Boulder, and Longmont. We're looking to identify a feasible location for a potential maintenance facility up in Longmont. This particular rail line is, if it were to move forward, would be a different technology than what our existing commuter rail trains are right now. So don't know if that's a DMU or battery or hydrogen or something to that effect, but it would not be a similar kind of car to what we have now with the overhead electrification system. We're coordinating with the BNSF Railroad right now. Obviously, we're going to be operating on their tracks. We currently have our own tracks all the way up to the existing Westminster station on the B line between DUS and Westminster. And after that station, we would have to, the concept is to run on the BNSF tracks themselves. So we obviously need to coordinate that operationally with them. And then we are evaluating potential train types and technologies. It's not the intent of the study to pick a particular vehicle, but we are looking to see what type of vehicles are available that meet our operational needs. As you probably are aware, we have high-level platforms at DUS, 41st and Fox, and PACO stations, and Westminster Station. And, you know, we want to make sure that whatever train technology we have will meet, you know, platform elevation heights, et cetera, that we want to make sure everything's accessible and usable for everybody. And then, of course, we're exploring opportunities right now with not only the Front Range Passenger Rail, but Additionally, with our Northwest Areas partners, the Front Range Passenger Rail, I think, presents a unique opportunity at this time. You know, they're doing a study as well that runs from, you know, looking at a train that would run from Pueblo to Fort Collins. And there's the potential that they would run on the same alignment. And that potential is, you know, provides some possible opportunities for us to share operating some of the costs potentially. So we're kind of excited about what those opportunities might bring. Next slide, please. And I will springboard into Megan's portion here, but definitely she'll talk a little bit about our ongoing process for environmental justice and equity, and how we could definitely use some help from all of you folks as well. So, Megan.
All right, thank you, Patrick. So I'm going to go into a little bit about our preliminary environmental justice analysis. And many of you probably already know what environmental justice is, but just as a reminder, it is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income. And, you know, it's focused on equitably sharing both the benefits and preventing disproportionate impacts on EJ communities. And it is required, this type of analysis is required for projects that use federal funding. So, you know, why does it matter to the Northwest Rail Peak Service Study? It's important for this project because it's a way to bring all of the community voices into the planning process. And then we can really look into how the benefits of this peak service are shared among the communities in the Northwest area. And then if necessary, we can look into how we can reduce the severity of any potential negative impacts that we identify through this process. So on your right, there's a map of the study area that we identified for environmental justice, and that red sort of bulb around each of the stations and the black and white dots, that shows our study area. And what we have is around each station, we have a 3-mile buffer. So kind of a 3-mile circle that shows the benefits of the increased mobility we consider would be most impacted in that 3-mile buffer of each station. And then along the corridor, you see that the buffer is much smaller. It's just a 1/2 mile from the track on each side. And that's because we see that area of the community being more impacted, but not receiving quite as many benefits as those that are within the 3-mile of the station. So, so we're looking, like I said, at impacts and benefits. And so we're looking at this entire area within the red shape here on the map that you see. And then we've identified through census data people of color and low income populations. So in the orange, you'll see the people of color that we've identified as census tracts that have a large presence of people of color. And then in the hash marks, the red and white stripes, the low income population that meets a threshold for the RTD district as a census tract that has a higher percentage of low income folks. So that's our preliminary map, sort of showing our study area and showing the communities that we identified through the census data. So next slide, please. All right, so our EJ process, our environmental justice process for this project. So we're in our first step right now. We're learning about the communities, and you know, I showed the census data map that we created, but we're taking it a step further, and we really want to talk to people in the community, those that are experts on their own community, and really understand, are there additional populations and communities that we can't find from census data? For example, recent immigrant communities or you know, unhoused populations that we can really identify benefits and impacts to those communities as well. So so that's where we're at. We're you know, interviewing community leaders. We have a survey, and we'll ask you in the next couple slides if you have some time to help us out with that that exploration and research that we're doing to understand the communities around the corridor. The next step will be to identify benefits and impacts, potential negative impacts. And we have a couple of workshops that we're planning. So we're really going to make that a collaborative effort. And we're even going to bring in some community leaders so we can have a really involved process. So that's another opportunity that we're looking for folks in the community to help us get involved in that aspect of the analysis. Number 3, mitigate. If we find any negative impacts, we'll partner with communities and really understand how we can minimize or avoid those negative impacts as the project develops. And then our final step is to collaborate. We'll be documenting the entire process and then really want to kind of hold on and cultivate the relationships that we've created with community leaders and organizations, community-based organizations that we can continue to partner in future RTD projects. Next slide, please.
So in the chat, there is a question from Commissioner Lochamin. She asked if the map for the EJ communities is available online.
It is not online. Oh, actually it is. You know, it is online. Thanks, Annette. I was thinking the RTD website, but you know, it is on our online public meeting for our first workshop. So actually, I think the slide after the next will have the link to that. So so you'll have the opportunity to get on that online public meeting and see that map and some of our other materials that we shared at our public meeting and our public open house. So, so that's a perfect segue into the next slide, actually. So, you know, what are we looking for as far as help? And I touched on this earlier, but we have this online public meeting where we can get your input on some of the information that we're collecting about the communities. We're looking for businesses that are owned by people of color or employ or support people of color, and also low-income community members that are within this study area that we've identified. We're also looking for community spaces or community resources such as, you know, parks, schools, food pantries, warming shelters, etc. So on the left, you see a screenshot from the online public meeting, and it allows you to kind of pinpoint a location, and that will really help us with our analysis. But I should say the online meeting also has other opportunities to give input on the overall Northwest Whale project that Patrick was giving us an overview of before. So, so that's one way to get involved. That online public meeting is open until February 21st. So about one more week. So if you have time within the next week, that would be a wonderful help to us. And then the second sort of red bold text here, the second way to get involved is to email or call our Northwest Rail project email address and just, you know, join our mailing list. You can express interest on getting involved in the next steps, and we'd love to have your support. So if you'd like to just email or call us, we'd love to involve you in the next steps of the process. And final slide, please. So again, this is the online public meeting. This is a QR code that will get you right to that online public meeting. And then we can put in the chat a link to get you to that online meeting as well, if you prefer that. But again, we'd love your input on that self-guided online meeting. And I think that's my final slide. So, we'd be happy to answer any questions that you all have. And thanks again for the opportunity to give you all an overview.
Great, thank you so much. I have a couple of questions, but I'll open it up to other people before I start chiming in. So I don't know if anybody else has something to add or questions to answer that you want to ask. I do have a couple of questions. So Boulder County, and I believe DRCOG also might have some data on like places of community interest in GIS format. Have you reached out to those types of organizations to get like a database of food pantries and schools and childcare facilities?
That's a really good question. We did do a scan of the corridor, and I can't remember which data sources we consulted, but I think we will definitely look into that one if we haven't already.
Okay, yeah, and you can reach out and I can connect you with who we have here, but we just went through and we made a list for our human services transportation plan. So human services coordinated plan. So
is that, do you know if that's available? Is that through their public GIS, their open data source website, or is that something you have to ask directly?
So that's what we created. So we so each of the, just so you all know, like each of the counties, well, no, it's actually Boulder County and then DRCOG, they have what's called the network of care. And the network of care is like a federal resource for human services organizations. And Lindsay, I don't want to misspeak, but basically it's Aging and Disability Resource Center. And so all of the human services organizations populate that with their data for information referral services. So that's where we got a lot of our data for our coordinated plan, as we plotted those from that. But like DRCOG from their Area Agency on Aging should have some basic human services, and then we have some for Boulder County. Okay.
Yeah, that sounds like a great source.
Yeah, and then I don't know if you want to speak a little bit to like low floor boarding and how that impacts individuals with disabilities or anything like that. I know, Patrick, you kind of alluded to the high floor and like possibly going with a different technology, but I don't know if you want to say more to that.
Well, yeah, let's speak to it just a little bit. So we're not done with kind of our final recommendation. You know, at one time the future rail platforms for the Northwest Rail were looked at as a low platform, and there's a couple of reasons for this. Is the BNSF brings in what they call high and wide loads along the corridor, and we can't do a high level platform right on the mainline tracks that BNSF operates now, because basically the train would hit it. So we'd have to step those back, which would include bridge plates and other type deployment things. We're still looking into that now and looking at possible vehicles and that sort of and what those the impacts might be to that. As of now, what we have in the plans that we're looking at is what we call a station siding, so that basically our trains would pull off of the mainline tracks, and we would have a high level platform just like we do on the rest of the commuter rail system. That's what we currently show. You know, like I said, we're not completely done with our analysis with that, but I think there's a lot of benefits to that, to having it done that way. Future expansion, and as well as, you know, I think from a customer experience and you know, making sure that we are in the highest level of compliance with accessibility laws and everything. That is kind of the surefire way to do it. It's also, I think it's frankly just, the reality is it's a lot easier to use for everybody. So I wouldn't say that's a done deal yet, but either way, we obviously have to take into consideration how people board the trains. For those that are familiar with light rail, you know, those are the low platforms, but you have to have the, you know, the high blocks and the bridge plates deployed there. And it's not, you know, that's a certain spot on the train. It's just not quite as conducive, I think, to accommodating everybody's needs. But that's kind of it right there. Part of it, what plays into it is the vehicles themselves. I mean, there are very few vehicles that actually would accommodate a high level platform for our existing ones and a low level platform. You'd have to basically have dual level doors, and then depending on which platform you need to get off, you know, where you're going to get off, if that's a high level or a low level, you have to be able to get from one level to the other within the train to make sure that you're at the right door at the right time. And, you know, again, from a customer experience perspective and just you know, just a logistics, you know, reasoning, that's not ideal for sure. And then, but, you know, we're also looking at, okay, what if we went with all low platforms and we actually did modifications at the existing platforms that are out there now? And, you know, a lot of it depends on train availability. That dual level train, as we're finding out, is a little bit of a unicorn. There's not a lot of existing rail cars out there that actually would accommodate that, a dual level boarding. So that's kind of playing into our consideration. But again, we're not completely done on that analysis.
Okay. Great, thank you so much.
Hopefully that answers your question. Okay, it's
yeah. And then just one last offer of like support. If you all, once you all get to the point where you're selecting community leaders, I'm sure that we could help be an asset in finding community leaders for BIPOC organizations or refugee organizations, just because we work with them a little bit more closely sometimes. So just reach out and let us know if you are at that brainstorming point of trying to figure out who the community leaders are.
Okay. Thank you.
Great. Well, thank you so much. I'm sure that we have a lot more questions later on, but we'll pass them on if we do. And I'm just thank you for stopping by today. I appreciate it.
No, absolutely. I appreciate the opportunity. And please feel free to go to the online meeting. It's a pretty much exact duplication of what we did in the two open houses that we held a couple weeks ago. A lot of good information in there, a lot more, probably even more in depth than some of the things that I talked about today. But we'd love to hear from anybody in the community. So feel free if anybody wants to give up their Valentine's night and do a survey instead of whatever's nicer than that. Feel free. But
well, love public transit. It's all right. Yeah. So it looks like
we'd love to hear from everybody. We definitely want to hear the voices of the community. So
yeah, looks like Jessica has her hand raised. I don't know if you have something before we switch. Presenters.
Oh yeah, I just had a quick question. I know it's probably too early to tell, but how did those open houses go?
Yeah,
I know you hosted a few. Yeah.
Well, it's went pretty well. We're still, the online open meeting is still going. It closes on the 21st, so we don't have all the data kind of pulled together yet. I'm trying to remember, Megan, you might remember the last information I got was probably 4 or 5 days old now. But we had, I think 120 people showed up at our north of Boulder location. And then we had 75, I believe, at Westminster. And then at the time, I think we got between the two, maybe 27 or 28 actual physical comment cards turned in. But I think we're multiple times more than that from the online meeting. Last number I heard was something like 500 comments. Megan, you might know a little bit newer than that, but that was probably coming on a week ago now. So it looks like we're still getting 40 to 50 comments a day or so, is what we understand. And, and those comments kind of seem to run the gamut. There's people that are excited about it, would use it. We get people that are excited about it, but maybe the peak service doesn't quite work for their needs. We've got a lot of folks, I say a lot of folks, we got some folks that are just kind of against it in general for the cost. But what we're going to do is we're going to take all that feedback and we're going to break it into kind of larger categories where those comments kind of fit into, so that we can better understand what people are looking for and what their concerns are.
Great, thanks. It looks like we have 2 more questions. So Cami, your hand went up first.
Real quick, Patrick, and you may have said this, so it might just be a reminder, but is your survey available, your information available in any other language besides English, possibly on your website?
Spanish.
Okay,
yes.
It is.
Yes.
Great.
Yep.
Thank you.
That was part of my question. Thanks, Cami. Sure. And then the other one was, I've heard from folks really curious about Longmont as a location for a meeting. And I heard you talk about Boulder and Westminster.
Yeah.
Was there a decision not to have a meeting in Longmont, or is it in the works?
Well, what we've decided to do is, obviously we're a long corridor. We got 35 miles to cover. So our intent is to sprinkle it kind of between them different meetings. So I think we're looking at Longmont for the next meeting and possibly Broomfield. Nothing set in stone there, but that's the idea, is that we would, we're kind of going to try to spread these meetings out throughout the corridor so that we're not presenting at the same place every single time.
Great. Thank you. One bit of feedback that I have heard from several different people is that the Niwot location was not accessible by transit. So if you all could select locations that are transit accessible next time, that would be great.
We did get that comment, and we're definitely keeping that in mind, how we can do that. So
wonderful. Well, thank you so much for stopping by today. And whenever you all have an update, just reach out and we'll see if we have room on our agenda to include it, or if information you want us to share in our newsletter, we can do that as well.
Sounds good.
Thank you, Angel.
Thank you.
Thank you so much.
We can hang on and learn more. Do you want us to get out of here, or does it doesn't matter how you want to do it?
We love spreading the the community of transportation.
Okay.
So I saw that Becky hopped on. I don't see your name right now though. Is Becky Porter on?
Yes, I'm here. It's showing me as Rebecca Porter. So yeah, I'm here though.
Okay, great.
And
so,
let's see, get my video going. There we go.
So I'll just do a little brief introduction. So Becky Porter, she works with the Division of Vocational Rehab. She is an O&M specialist, which is orientation and mobility. So I asked her to stop by today to kind of give us an overview of some of the O&M supports. So I'll turn it over to you, Becky. I don't know if you have anything you want to share, but I think you should be able to share your screen if you need to.
Okay, yeah, I do have something to share. So let me see if I can't get it set up here. Okay. Is my PowerPoint presentation there? Okay. So, and then I'll just try to describe the PowerPoint to you as well, just for anybody who doesn't see it and wants to know what's on the screen there. I'm, like she said, my name is Becky Porter, and I'm with the Colorado Division of Voc Rehab. So I'm here today to just kind of explain a little bit about specifically our orientation and mobility services. So I do have a PowerPoint presentation. It's kind of got a black background with mostly white text. This particular slide has a picture of the CDLE logo on it. And it says Division of Vocational Rehabilitation, Blind and Low Vision Services Unit, Orientation and Mobility Training. So just a quick introduction of myself. I am a certified orientation and mobility specialist with the Colorado Division of Voc Rehab. I've been working for DVR for about 16 years, and my office is out of the Loveland area, but I do cover everything in northern Colorado. I like to say I cover north of Denver and east of the mountains. So we do include Boulder and Longmont in our area. Just to make sure people understand what the Division of Vocational Rehabilitation is, or DVR. We are a state agency within the Department of Labor and Employment. And DVR serves anyone who has a disability that creates problems with obtaining and or maintaining a job and who needs rehabilitation services from DVR in order to be successfully employed. DVR, so obviously you do need to work or want to work to be available for our services, but we do serve students from age 15 to 21 and also working age adults. And then what are some of the services that DVR provides? DVR provides evaluation and diagnostic services, vocational counseling and guidance, referral services, physical and mental health restoration. So, and I can explain some of these. The evaluation and diagnostic might be just to help us determine what is the disability and what are possible barriers to employment for that particular person. Physical and mental health restoration, that can be things like hearing aids so that somebody can, hear better at work. And it can also be mental health counseling for people who need some of that. So there's kind of a lot of this will cover many, many areas. Training services, this is the part that I'm here to talk about, is specifically personal adjustment training, but we also offer other training services. It might be help with vocational training or college classes. There's a huge variety there in the training services. Services to employers can include stuff like this presentation, coming into an employer and explaining what DVR is all about. But it can also include things like disability awareness training and help with making sure that you're offering accommodations for your employees, things of this nature. Rehabilitation technology is one of our areas that we may be purchasing goods for somebody, and that might include things like computers or software to access their computers. Magnifiers, there are a lot of things in that area as well. occupational licenses, tools, equipment, and supplies. That can be things like mainly for people who are going to be doing self-employment. So anything that they would need to get their business started. Placement services might be help with doing a resume or interview skills and helping people to learn how to, the things that they need to be on the job. And then support services, this is something that you may be interested in, and this may be some transportation. So sometimes we do buy bus passes for people or help pay for door-to-door transit, any kind of things that would help them get to work or get them to their training program. And then post-employment services, once somebody is working, whether they need to be successful on the job. Sorry, I was just looking at the chat to make sure there weren't any questions over there.
I think people are just putting their name and organization.
Okay, thank you. All right, so I am specifically within the Blind and Low Vision Services unit. And so that's just a smaller unit within the Division of Vocational Rehab. And as the name would suggest, we specifically work with people who have vision impairments. So who does the Blind and Low Vision Services unit serve? We serve anyone who has a functional visual impairment that results in a barrier to employment. So this is based on difficulty performing certain tasks rather than a specific visual acuity, visual field, or diagnosis. So, you know, a lot of people will think of legally blind, which has some really specific numbers behind it, but we're not really looking at whether somebody is legally blind. We're looking at whether or not the fact that they have a vision impairment is creating a barrier to their ability to be successful at work. So that can include somebody who is totally blind, but it can also include people who have low vision, who have other functional vision loss, and work with somebody who has more of a neurological vision loss. And it can also include people who are deaf-blind. And so just to give a couple examples of some people who, different low vision loss, if somebody has, say, a central visual loss, they might have some difficulty with reading or accessing the computer or doing tasks of that nature, but they might be getting around okay if they still have some peripheral vision. Now, somebody who has more of a peripheral vision loss might be doing okay with some of those reading tasks or accessing the computer, but having a harder time with getting around, for example, tripping, bumping into things, tripping on curbs, things of that nature. Within the Blind and Low Vision Services unit, we also have a unit that is called the Personal Adjustment Training, or PAT unit. So again, this is the unit that I'm a part of. And you probably want to know, what is personal adjustment training for the blind and visually impaired? It's going to be training in the skills and strategies that help a person who's blind or visually impaired to function independently at home and in the workplace. So it can encompass things like orientation mobility training, which is what I'm going to talk about today, or the main thing that I want you to take away from today. But it can also encompass daily living skills, adaptive communication, assistive technology, low vision training, and workplace accommodations. And we believe that all of these skills are critical for success in life and work. Orientation and mobility training. So this is one of the first slides that actually has a photo on it. And this picture is of, it looks like a gentleman walking with a white cane, but you can only see him from the waist down. So he's wearing black pants and black shoes and white cane with a white tip. And it looks like he's walking in what I would say is sort of a downtown business environment. It looks like some high-rise buildings in the background, and that he's walking across like an open square. So orientation and mobility training is training in travel skills, and it can include people who are using white canes. It can include people who are using a dog guide and even using a human guide. And we do training in both familiar and unfamiliar areas. We do training indoors and outdoors, and then residential and business areas. And we cover street crossings of all types. So This would include your really basic quiet residential intersections, but it also is going to include stop sign controlled intersections, four-way stops, lighted intersections, your more complex lighted intersections, the ones that have right turn islands or are a funny shape like a T-shaped intersection. It's also going to include roundabouts. Pretty much any kind of street crossing that a person might come in contact with, we're going to cover it in our training. We're also going to cover public transportation and or paratransit. Paratransit, not everybody is going to qualify for that or want to use that. A lot of people are going to be using public transportation. And so we're going to be covering how to find the bus stop, how to make sure you're getting on the correct bus, where to sit on the bus, how to request the correct stop that you want to get off at, how to plan your route, anything related to successfully using public transportation. And then on workplace routes, we're going to be covering, well, it might be how to get to them from work, but it also might be orientation within the workplace itself, and also things like, you know, what to do in an emergency, where's the closest emergency exit to your office environment. All right, I see a lot of chats, but I'm not looking at the chat box. So are they just still people introducing themselves?
We just have, Penn just said that she really appreciates, she worked with you before and she really appreciates everything that you've done to help her and everybody else. So
oh, thank you.
It's the only one that was pertaining to this. So I'll let you know.
Thanks, Penn. All right, so that's orientation mobility training kind of in a nutshell. I do want to just quickly touch on some of the other stuff that we do because we're looking at well-rounded training to make sure that somebody knows everything that they need to be successful at work. So another area that we work in is called daily living skills training, and this is going to encompass pretty much everything that you need at home. The photo on here is another close-up of a person just in between maybe like their waist and sort of midriff, I guess, and you can see their hands as they're chopping carrots with a large knife on a cutting board. And then text on this page for daily living skills talks about, you know, cooking, cleaning, home maintenance and safety, financial management, time management, laundry, taking care of your clothes, medical management, care of family members, pretty much anything that's kind of your daily life is going to be in this area. And as you can imagine, that's pretty important for work, being able to, you know, make sure that you're wearing clean clothes when you go to work and take care of your home. That's all important too. The next slide is about adaptive communication, and this one is an extreme close-up of somebody reading Braille, so you see just two of their fingers as they're reading across a Braille page. And in adaptive communication training, we're going to be covering essentially access to information. So especially access to printed information, but it's going to be things like Talking Book Library, audio newspaper services, so shout out to Penn over at AIN. So that's one of the services that's going to be providing, we're going to be hooking people up with for that. It can include Braille instruction, paperwork management, filing, handwriting, note-taking, use of a telephone, anything that would fall in kind of the communications area. This is a slide about our low vision training, and this one has a photo of, again, close up because you can only see the person's arm, and they're holding a pen with a piece of paper. It looks like they're writing on a piece of paper, but that piece of paper is under a, looks like a portable CCTV camera, and then you can see their laptop next to them, and that camera is putting the photo of that piece of paper up on that laptop monitor and magnifying it quite big. So for low vision, this is going to be for somebody who does have some residual vision and is going to be using typically magnifiers and tools of that nature to make it easier for them to read things. So it's going to include a lot of times magnifiers or CCTVs, which stands for closed caption television, but it's just this camera system that you're looking at here in the picture. Also portable electronic magnifiers, which are very similar to this, but smaller and more easily transportable. Binoculars, it can also be sunshades. So there's kind of a variety of low vision aids that we might use with somebody to help them access visual information. And then we also have assistive technology. We have like a whole group of people who teach assistive technology. And this is going to be, well, let's see, there's another photo here. There's a person accessing a laptop, and you can see just their hands on the keyboard of the laptop. And I would say on the screen of their laptop, they're looking at photos maybe. But for computer technology and looking at accessing a computer for somebody, we might be looking at a screen reader, which is going to read the text on the screen to them, or a screen magnifier, which is going to blow up that text pretty big so that then they can access it visually. And so it's that software to access the computer, but we're also teaching people basic computer skills, specific apps they might be using on the job, how to do anything on a computer that they need to be able to do. And then for somebody who reads Braille, we might be also helping them with Braille Note Taker or a Braille display to access that same information with their fingertips rather than either through audio or visual. And it can also include smartphones. So where are services provided? We provide these in a person's home. It can also be provided in the local DVR office, at their vocational school or college. You know, I've worked on the CU Boulder campus quite a bit. It can be at their job site. It can be in their community. It can be also for group, in-person, or remote workshops. And all of that training is, excuse me, that slide moved a little too early there. All the training is tailored to each individual's unique needs, circumstances, experiences, their job, employment goals. It's pretty individualized, and so that's why we take the training to the person in the place that they need the training. All right, so how's the PAT unit structured? In total, there's 15 staff positions serving the state of Colorado. We have 10 field staff, and then we have 5 of those AT unit specific staff. That's the assistive technology unit staff. The staff are located in offices throughout the state. We have quite a few in Denver. We have 2 or 3 in Colorado Springs. We have Loveland, and then the Western Slope. You might be wondering if other agencies provide services for the blind and visually impaired in Colorado, or these same services, the personal adjustment training services. And yes, they do. Some examples include the Colorado Center for the Blind, or CCB, which is in Littleton. And then there's also private vendors. Those can be O&M specialists or assistive technology specialists or nonprofit organizations. So some examples of some nonprofit organizations that might be serving Boulder County would include the Ensight Skills Center, which is headquartered in Fort Collins, but has some satellites all over. And then also the Center for People with Disabilities might provide some services there in Boulder County as well. And then this slide says how to find out more. Our website in particular describes our services, and it also links you to several informational videos about our services. So I think that's kind of how I got invited to this meeting in the first place, was I sent Angel some copies of our videos. And these videos are something new this year, but they kind of explain our services and also give testimonials from several of our previous participants in terms of how the training specifically helped improve either their independence or their success on their work site. And so I couldn't figure out how to link that directly into this PowerPoint, but I do have the website there, which I can read off in just a second. And if you go there, it'll give you more information, but it'll also allow you access to those videos. So the website is https. Well, actually, you know what? Maybe we should just paste it in the chat, but it's basically dvr.colorado.gov/dvr-programs-services/blind-low-vision, and then /personal-adjustment-training. Oh, and I think that was the last one. Just questions. This one has a photo of a little kitten that's a multicolored sort of tabby kitten with their head caught to the side, like they're kind of wondering, they're asking a question.
Great.
And so, I will stop sharing my screen maybe now.
Yeah, that sounds good. And I just put the URL in the chat. So if you want to access the PAT, the personal adjustment training resources there, they have some videos posted below. So also, I just wanted to also follow up and let you all know that we will be hosting DVR to come give another presentation in April at April's meeting. In particular, we've invited their business services representative. I'm not sure if I got his title right, but
all right, there. He's a business outreach specialist.
Yeah, so he's a business outreach specialist, and he helps organizations, helps work with organizations so that they can hire people who are from the Division of Vocational Rehab Support Programs. So if you're interested in exploring how to do, I believe, internships or job placements with DVR, it could be a great resource. Yeah. Any questions for Becky before we move on? I think we're getting towards the end and people are getting quiet, but I just think that's great, the amount of support that you provide people. And then also, I don't think you mentioned this, but like, how often will you go with people on the bus, or how often will you go with them on an orientation around their like job location site?
That's an excellent question. You know, like I said, it is highly individualized. Typically, when we're providing orientation and mobility training, we're seeing the person we're working with once a week for an hour, maybe 2 hours. It kind of depends on what we're working on. In the winter, it gets cold. You get cold after an hour and you want to go in. In the summer, you might want to work longer. When we're riding a bus, you've got to allow more time to take your full bus route and get where you're going or get back. So it kind of depends, but typically we're working with somebody every week. And you know, for a person who's never had a cane in their hands at all and needs to learn everything from the ground up, it can take a long time. It can take up to a year before they've learned all the skills to feel confident to go out, leave their front door and go on the bus to a destination. But for a lot of other people, they have already had a lot of that basic training, and so now they're just learning the specific route to get to work or their specific area around work. And so in that case, it wouldn't take nearly as long.
Yeah, great. And then do you work with the transit agencies in any capacity, or like how do you just know the system and don't really work with the transit agencies?
I would say both. So, you know, like I said, I cover all of Northern Colorado, so I've got quite a few transit agencies in my area. And so for a particular person, just a couple of weeks ago, I worked with the City of Loveland Transit and brought my person into their actual bus depot or bus barn. I don't know what you want to call it, but they allowed us to go on a bus while it was parked and really thoroughly explore that bus and learn that area before my person was out there riding a bus with the public. Which was really nice and helpful. So I work with people in that context, but then also knowing sort of what the resources are and making sure everybody understands, everybody I work with knows their local transit agency. But then also there's a similar group to this in both Weld and Larimer County, and we do have representatives on each of those councils. So we also work with the transit agencies in that capacity.
Yeah, great. Wonderful. Any questions for Becky before we end her presentation?
I think Sarah had a comment in the chat. She says, Becky is also awesome if you feel intimidated and don't even know what you need. That you can help people know how to approach those things that seem intimidating.
Yeah, great.
Thanks, Sarah. I'm glad to hear it.
Sorry, I'm on the bus and that's why it's loud.
We can hear. We're good. We can hear you. Just yeah. Great. Thank you. So there's lots of love for you, Becky, in the chat. Everybody says it's great to know the services are available, and yeah, just in general, just very supportive of what you do. So thank you so much, and definitely feel free to stop back by and listen in on the conversation if you want to hang out with us again, and look forward to chatting with your business outreach specialist in April.
Yeah, I'm really glad that they can come and tell you more about everything that DVR does, because we do a lot more than just I'm like a very, very tiny piece of a very big organization. So I'm glad that they'll be able to come and share.
Yeah, it's very specific to transportation though, what you do. It's very
right.
What we do,
right.
So, yeah.
I'm the one out there on the bus.
That's great. Okay.
Thank you so much. Thanks for having me.
Yeah, no problem. And
thanks, Becky. That was really good.
Thanks, Sarah.
Yeah, of course.
Great. So that takes us to the end of our meeting today. We will meet on March 13th, and we are going to be having a panel discussion on the driver shortage. So I may be reaching out to a couple of you for referrals, like who best from your organization might be to like speak about it. And if you are interested in helping plan that panel discussion, please let me know. So I think that should be a good discussion, because obviously we know that the driver shortage really kind of impacts like what we can do as a region. So thank you so much for showing up today, and I will see you all March 13th.